Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. When you were making these initial decisions as to what treatments to go through and things like that, you started with chemotherapy.
Yes.
Did you think you were going to feel worse or better after starting? Like, what was your perception?
100% worse.
Right.
I thought, okay, well, I'm sick now. Once I have chemo, it's the end of the end. It's going to further make my body toxic. In addition to the cancer, I'm just going to have a slow demise. That really was my opinion. But yeah, to feel as great as I did, I was like, wow, what happened? How is a toxin making me feel so good?
So it's interesting because a lot of people have that perception that I'm not feeling well now. I don't want to poison my already seemingly failing body, like if I'm fatigued and all this stuff.
Right.
But you still went through with the chemo.
Yep.
So what was the decision making there? What was the thought process?
I mean, the thought process was, for my case specifically, I had fluid in my lungs. I was getting drained on a 3-week basis, about 2 liters every 3 weeks, which is pretty substantial. And that was really affecting my quality of life in terms of I can't breathe that well because my lung is full of fluid. So that really was the catalyst for I want to get treated ASAP because I was told that potentially on treatment, the fluid could recede. So that was my biggest motivator, because if I hadn't got treatment and I just decided to go on complete hospice care or something like that, my fluid would just continue, and perhaps even be even more aggressive. And I Googled a lot about fluid in the lungs and how that was X amount of progression in terms of a bad sign and things like this. So I was like, okay, well, I really need to get treated no matter what. Even if it backfires, I just want this fluid out of my lungs. And I was told over and over again, there was no guarantee that it would get rid of the fluid, but there was a chance, and it was making me miserable. That was my only side effect, really, that was impacting my quality of life. So I'm like, I'm going to give it a shot.
Yeah. And to add a little context for the audience, when we're saying fluid in the lung,
sorry, yeah,
we're describing as yeah, well, I clarify this a lot because it is confusing and it requires, some kind of complex knowledge of the anatomy there that I didn't get, before embarking on a medical journey. So in your chest, you have your left lung and your right lung, and they are up against the chest wall. So when you take a deep breath, it expands your lungs and they open up, you get air in. Surrounding your lungs is this area called the pleura. And then it's like a very gentle area that, or film, I suppose, that can slide easily, and it prevents friction from, that area is very smooth. That area between the chest wall and your lung is what ends up filling with fluid in this process called a pleural effusion. So that area can fill up and it can compress the lung. It's almost like a collapsed lung in that the lung gets pushed together, really hard to open it up, hard to get enough air, very uncomfortable. So those are really symptomatic, and metastatic disease can often cause fluid building up in different areas. It can be in the abdomen, it can be in the lungs, it can be in other areas. So that's what we mean when we say the fluid in the lung.
Thank you for the clarification.
Well, and to drain that, one can stick a needle in, pull the fluid out, and someone will feel better for a little while. But if the cancer's still there, it's going to keep accumulating fluid usually.
Yeah, so, it was not a pleasant experience at all. It was the worst symptom. And again, I appreciate the explanation because I had no idea it was a thing. I didn't know what a pleural space was. I had zero idea what that was. I didn't know our lung had a coating around it. So, learning all these things I didn't want to learn. But, for lung cancer specifically, I know there are some people that have a primary lung tumor and then they have a pleural effusion and that's all they have. And correct me if I'm wrong, but that's defaulted to stage 4 metastatic if the pleural effusion is cancerous in nature. And so that was really interesting to me too, because I'm like, wait a minute, that's just part of the lung. But it defaults you to stage 4. And I'm like, huh, that doesn't make sense.
These are the explains the asterisks that I have when I say
Yeah.
generally speaking, consult your oncologist, because there are always these caveats as to what we consider stage 4 or metastatic disease, because in these potential spaces, the area around the lung that can get coded, and that's really, really hard to remove cancer once it's gotten to that area. So we do classify that as stage 4. And then once someone is stage 4, the treatment options or what we think will be helpful changes.
Mm-hmm.
And so I think a lot of people have the conception that stage 4 is not worth treating. And hopefully from what we've been describing today, stage 4 disease is very much worth treating.
Yeah, absolutely.
Sometimes when cancer has metastasized locally to local lymph nodes or in other areas of the body, sometimes we can still try to cure that. So that's a reason to seek further care if you're apprehensive, because I think there's a lot of negativity out there, but every situation is unique. If someone's diagnosed at an earlier stage, a stage 1, 2, or 3, oftentimes those are the stages where they haven't, the tumor has not yet gained the ability to go into the bloodstream, to spread to different areas. And those usually we are trying to cure. Those will often have surgery or radiation alone. They might have surgery or radiation with a therapy that goes throughout the rest of the body, like a chemotherapy, or for some tumors, there are pills. Other places or other tumors will give immunotherapies. So there's a lot of things that might be involved in a stage 1, 2, or 3 cancer. By and large, with stage 4 cancers, that's when we're talking about the therapies that go everywhere in the body, because you want to get all those seeds. This is the weed killer analogy. You want to go everywhere. And then often after we do that is when we might look and say, okay, do we still have a chance of cure here? And that's when we talk to the radiation oncologists, we talk to the surgical oncologists. But just because someone is stage 4 or metastatic, for me, doesn't necessarily mean we're going to accept that this is incurable.
Can we talk a little bit about the term NED? So no evidence of disease. So in stage 4 cancer, the word NED is used quite a lot and celebrated. I'd love for you to go into that a little bit in terms of like, what does that mean? And why do people celebrate it? And is there a misconception around it? Because what I've learned personally is like, and maybe you can go into this too, is for me specifically, when you have stage 4 lung cancer and you're having treatment and things are stable, the word stable is celebrated because it essentially means that your cancer is not growing and not going to other places. And so stable is a really good thing. Like the cancer can just hang out in my body the way it is and we're good and we can be stable. But I don't think people celebrate the word stable as much as no evidence of disease. And I would love for you to touch on those two items and like what they mean and maybe give some people more hope in the sense of celebrating stability, because I don't think people celebrate stability enough in stage 4, and it should be celebrated. Because I think there's a misconception of, oh, I still have cancer in my body, it can still be seen. But yeah, if you can go into those 2 items, that would be awesome.
Yeah, it's a complicated area. So first, I want to ask, I'm going to flip it back to you a little bit.
Okay.
When you hear NED, what does it mean to you on the patient side?
From my perspective,
And what do you mean when you say NED?
When I say NED, it means on a scan that you went into, either a PET scan or a CT CAT scan, you visibly cannot see anything that is cancerous. But to me, that doesn't necessarily mean there aren't cancer cells kind of flying around in your bloodstream. And it doesn't necessarily mean that there aren't things there that you can't see, as you described before. It just means you literally can't see things on a scan. That's what it means to me.
I think that's my understanding too. We use this term NED, no evidence of disease, is the actual full acronym. And I'll give an example. If someone has a 4-centimeter tumor in their lung here, and they get a treatment, they take a chemotherapy or they're on a pill, and it goes away. You can't see it anymore. We would call that NED. It went from something to nothing. So we say on the scan, there's no evidence of disease. Now we choose our words fairly carefully. We don't say there's no disease. And in fact, I assume there is.
Mm-hmm.
There is a phenomena that occurs with cancer where you have, out of the millions and millions and millions of cells, billions of cells that make up a tumor, you'll kill often 95, 99, 99 plus % of them, but that still leaves a lot of tumor there under the microscope.
Mm-hmm.
You can't see it. It's not going to be a physical mass because it's too few. But those residual tumor cells are there probably for most people, and they're being held at bay through a combination of a therapy that one might be on, and still the immune system can often do a good job, if it's not overwhelmed, maintaining tumor cells where they're at. And this is a generality speaking. This isn't going to be applicable to everyone's tumors in all circumstances. But when I think of this term NED, this is actually the phenomena that I'm imagining in my mind, is that there is a small volume of tumor cells and they're being kept at bay, which is good. There's no reason to not celebrate that.
Absolutely not. I just, and I'm very happy for those people that are. I just think there's almost a pressure to get there, or like, why am I not getting there myself? And does that mean I'm failing at stage 4 because I'm not getting to NED? I feel that pressure personally. Yeah. And I just think there's a misconception of like, stability is really good too.
Yeah. Well, when that phenomena is happening, in my mind, there's probably still tumor there, even if you can't see it anymore.
Mm-hmm.
And that is stable.
Yeah. So interesting. Okay.
So that ends up being a new stability.
Yeah. Yeah.
And then if your tumors shrink down, and rather than no evidence of disease, you have less, you had a response of some sort. Mm-hmm. Or even if you don't have tumor shrinkage, but it's not growing, you have more tumor there, and more tumor is always not as good as less tumor. We always want less tumor.
Yeah.
But if the tumor's not growing, then the tumor is not going to be the thing that ultimately ends one's life.
Right. Right.
So if we could keep a 5-centimeter tumor at 5 centimeters forever, I would be happy with that. And it's not a tongue-in-cheek thing to say. sometimes we do have these cases where you'll have a tumor you can see on the scan and it hasn't budged. It
Mm-hmm.
stays the same size for a long time. And this gets into another one of these, I'll say, unfair situations in cancer where someone can have an excellent response and some cancers will come back very aggressively
Mm-hmm.
despite a really, really good response. And other tumors will not have much of a response at all, but they're just going to hang out there.
Yep.
And there's nothing fair about that. But I do hear it in the community. Everyone wants NED. That is the
Yeah.
goal. No evidence of disease.
Yep.
And there's no doubt that better response to a therapy is better,
Yep.
generally speaking. But these aren't rules. These are generalities and they don't apply to everyone.
Yep. And this is the roller coaster of stage 4 cancer for sure.
Yeah. Yeah. Nothing about this is fair.
Yep.
Wasn't fair in the
Yep.
beginning. It's not going to be fair throughout the process. A lot of times I'll talk to my patients, and if there's a progression or if something doesn't go as well as they want, you have to accept that some of this it's just not fair and there's no silver lining.
Yep.
That's it.
Absolutely. Absolutely.
And
And I know I joke with you on a regular basis, like especially for individuals who have stage 4 cancer, who are asymptomatic, who don't have that many, barely have any symptoms or any symptoms at all. Like, why can't my cancer just like hang out in my body and like be okay with that? Surely there's a happy medium where I can live my life and the cancer, can hang out but not get worse. And I guess that's stability, right? Is just letting it hang out and not cause you symptoms. So I wish for the future that one day stage 4 people can just be stable indefinitely and it becomes a long-term disease instead of a really bad cancer prognosis potentially. But yeah, maybe we'll get there one day.
yeah, and to your point, there are examples of cancer where we have medicines that can keep them at bay for a very long time,
Yep.
years and years and years.
Yep.
This isn't on the order of months. We're talking half a decade, longer. Um, so we're getting closer, but the reality is we need more research to keep hitting this hard. And cancers grow, they metastasize, they adapt to treatment, all because they evolve.
Mm-hmm.
And the cancer is going to keep changing, and we need to keep finding ways to change with it. Figure out how it changes, predict how it changes, and learn how to target that. And I'm happy to say that we have a lot of initiatives in the research community that are doing just that. But cancer research is slow, and we need more funds, which
Yep.
is a big goal of everything we're doing here. And I think the plea of cancer researchers everywhere
And I
is
think that's a topic to hit on. Maybe it could be a podcast on its own. Honestly, is when you're at stage 4 and you're having treatment and it's going so well, why does it suddenly stop working? And why
yeah,
do you then have to go on to another treatment? And, before I was diagnosed, I didn't know that that was a thing. I kind of just thought you were given a treatment. And then something goes wrong or something happens and unfortunately you pass away. That's really what I thought. I didn't realize it was like, okay, well, there's potentially 5 options that we can try and you're on one for X amount of months or years, and then you go to the next one and then the next one. And I now know they're called lines of treatment, which I didn't know that. But that's a big component of what stage 4 is, essentially, is going from treatment to treatment. And like, why do cancer cells become resistant to medicine when they are initially had such a fantastic response? And that is the biggest frustration of this whole stage 4 roller coaster that I'm on, is like, why does that happen?
yeah. I think that's a a big topic and one we're happy to
Yes.
cover, how tumors
Yeah.
evolve. So
Yes.
something for everyone listening for you to stay tuned to. But for now, I think this is a good place to call it. Hopefully, everyone learned something about what the term metastatic means, what it might mean for your life, your loved one's life, how it might influence therapy. As always, like, subscribe, and visit crackingcancer.org. Let us know whatever questions you have, and we will see you next time. Bye,
Thank you,
everyone.
everyone.
Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.